Welcome, welcome once again to our weekly health talk. As you know, for those of you who are come here every single Tuesday, for those of you who've watched the recordings, we all about health. My name is Kerry-Ann Joseph-McLean, and my co-host Corner-McLean. I want to welcome you to our health talk topic on diverticulitis, and also diverticulosis. So there's many things that are common to certain conditions and certain type of symptoms are similar in other type of diagnosed illness, but some of them have underlying conditions that are so related, right? So just want to put out there that, for myself and my husband, we have transformed our lives by wanting to be aware, to be more informed. So we don't want to be more proactive. Are we always proactive? No, but at least knowing and learning and growing and developing as you're here on this platform, it's super important that as you're here, that you are gaining more knowledge that you can take back now to your daily life. And to be able to say, well, okay, I can apply this, or I can seek my doctor, I can ask information, be more informed. And so for me, I am not a health practitioner, neither my husband, Corner McLean, but what we are health enthusiasts. We've been doing this for almost a year. Can you believe that? Time flies really, really fast. Almost a year without fail. Whether you're flying, traveling, vacation, snow, rain, sunshine, we are here. We're committed to adding value to your life. And so as I share this with you, whether it's one life that we change or many lives that we've changed, we know that we have done, we've actually done what we are, in my mind, called to do, which is to elevate each person to lead them better as we met them to enhance their life, whether it's through health, through word, through thought, or deed. So I'm sharing my screen with you. Please feel free if you have any questions. There's going to be a Q&A at the end. You're more than happy to be more than happy to try to address some of the questions you might have or maybe some insight as to what I'm sharing this with you as well. So if you can see the slide, put a 1 in the chat for me, please. I'd appreciate that. Okay, awesome. Thank you so much. I appreciate that. So as I share information on this my tongue's not working today, diverticulitis. There's one person that I met many years ago, and I never heard about this until she shared this with me. And I was doing a presentation on health benefits of natural ways and showing superfood as to how conditions can be improved because you're giving your body the things it needs in the way of like for example nutrients. And she mentioned she had diverticulitis and she's always doing the wrong things and eating the wrong things and she knows she's going to have a flare up. So again, it's a mindset, being mindful of what you're eating, how you're thinking, how you're moving, how you're sleeping. But what I'm going to share with you is just a little bit of snippets of different areas, which for myself, the information I've found through credible sources like Harvard, Mayo Clinic, even PubMed, WebMD, other places that have credible information stored there in a way of resource. And so I put like a hyperlink in some places that you're able to gather more intel. All right. So as I share this with you, maybe some things might trigger your memory. My slides, make sure working. Different types of, and if you can hear me, like I mentioned, for some reason, my camera is not working properly. Just give me 1 second to make sure I'm okay. Okay, perfect. So there are different types and classification of this type of condition. One is uncomplicated, it's a mild infection treated with antibiotics and rest. And one's more complicated types that, for example, that involve serious issues like abscess, fistulas, perforations, and usually needs surgery. So there's more information for problem that I found as well. And so the diverticulitis is a condition that occurs when tiny pockets that have formed in the colon, most in the large intestine, become inflamed. So it starts as diverticulosis and then goes to the next stage, which is diverticulitis, which is the development of these pockets over time. So this condition is fairly common, especially in older adults. 50% of the people over the age of 60 have the condition according to some estimates. Again, the source is at the bottom as well. So we want to ask ourselves, when do you need to sort of identify if this is just a simple stomach ache or it becomes more serious? So the difference between the two, there's a major difference, of course. So in the colon, the diverticulitis and diverticulosis can also occur. So in less common painful, as we mentioned, and can cause consequences. So it's where this is frequent occurrence and it goes unreported because you don't really realize you have it. So diverticula, small pouches or sacs that form in the colon wall cause this condition, which is diverticulosis. That usually doesn't show any symptoms and it could go unnoticed until someone has to do a regular imaging or even a colonoscopy. And most people, especially in North America, you're asked to do your first colonoscopy at age 50, unless you have a family history of, maybe colon cancer or any kind of cancer, and they want to make sure that you're not at risk. So at that stage in your life, you may be under the age of 50. So those are rare cases. So this condition, as I mentioned, little holes or pouches, they grow in the muscle of the colon or large intestine. So the infection can happen or inflammation. So these are atypical pouches. So these are known as the diverticulosis, as I mentioned before. And this disease is collected for various illnesses. As I mentioned before, things are connected. You may have an inflammation and you have another condition, but this could also be an underlying condition, undiagnosed, of course. So it's a result of inflammation or infection of one or more of the diverticula in the colon walls. Excuse me. So this can produce symptoms like fever, chills, stomach cramps, even diarrhea or constipation. And the lower left side of your abdominal, that's where you may have an occurrence of pain. So the inflammatory disease of the colon occurs results in genetics, lifestyle, other factors including diet. Specifically, a diet that is low in fiber and high in animal fat can put you at a risk of developing this potentially serious condition, according to Mayo Clinic. Again, the more details is in the article on the mayoclinic.org. So there's another condition called ulcerative colitis, which have similar, not all, similar symptoms, but there's a overlapping of some conditions. So for this ulcerative colitis, you have the inability to control your bowel movements, fever, exhaustion, diarrhea, weight loss. And on the flip side of that is the new constipation, new diarrhea. So diarrhea can happen in either case, but the overlapping of those two conditions that it may either be misdiagnosed or not diagnosed is that the pain in the abdomen happens for both cramping and bloody stool. So be mindful of that. So if you're constipated, you may have blood in your stool. So sometimes that's also an indicator that you need to seek professional help to be able to identify or rule out certain things to make sure that either you have it or you don't. Also, for this ulcerative colitis, excuse me, excuse me, there's another thing too as well, which is the sudden weight loss. And then the tenesmus, which is the bowel urgency. So this I also want to bring to your attention. I'm so sorry. Some of the early signs of this condition, that if you're not diagnosed, is a constant abdominal pain. So ever so often, if you have a flare-up, you've been diagnosed with this, you know what the symptoms are. But if you don't know and you haven't been diagnosed, there's a constant pain in the lower left. And of course, you're suffering from constipation. So it could be an indicator this is something that's happening or about to happen in the way of this condition. Um, to the extreme is that you may have constant pain from basically infrequent occurrence to more frequent occurrence, where you're having more pain, more consistent, or more persistence for days at a time. So it's also another indicator as well to be mindful of. So I mentioned before the risk factors for this condition, diverticulosis, increasing age, being very overweight, low fiber, but also an imbalance in the gut microbiome. This is something that we've ever heard of leaky gut syndrome. This also could potentially tie into that as well. And of course, I mentioned before family history. One of the sedentary lifestyle is smoking and alcohol, also excessive caffeine consumption can also contribute to this condition. The incidence of this condition, of this illness, increases with age, but as I mentioned before, it could be linked to obesity, which could be a double whammy there. So the older you get, the more likely it is that you will develop this condition. Usually it's harmless, as I mentioned before, but most times it goes undiagnosed. So what I want to share with you is I mentioned the highlight of some of these conditions, but what the breakdown is for the abdominal pain or tenderness, it indicates inflammation or onset of inflammation. So it starts in the localized abdominal region where it's spreading throughout the abdomen. And then nausea and vomiting can happen, indicating that abdominal stress from inflammation, again, keyword inflammation, tension, pressure, or total discomfort, or even leading to vomiting. So vomiting is a forceful and involuntary expulsion of the stomach content out through the mouth, which we know that. But if you have pain, nausea, and vomiting, these are some indicators as well. So follow nausea caused by abdominal stress. If your body is stressed, this can happen as well. Changes in the bowel habits. So for example, the early indicators could be digestive in your digestive tract, which is your GI, your gastrointestinal tract. And this can cause many issues, including frequent bowel movements, sometimes indigestion. So constipation is a one sign of diarrhea, so to speak. And then you have full-on diarrhea, which is basically frequent BM movements. So constipation can also indicate this inflammation, which is also part of the intestinal tract. And of course, when the colon is in distress or it absorbs excess water from the stool, this can occur. So the strong indicators of these, and of course, seeking your health practitioner is so important. Bloating, sometimes we have bloating either because we have some women, of course, are going through this cycle, and that's part of you may have a BM before your cycle starts, or maybe you have some sort of gluten issues, some sort of food sensitivity. So again, keep in mindful of all those things. But these are some of the indicators as well for your gut microflora. There's a disruption there. So your gastrointestinal tract is where most people, all people, keep their emotion. It's your second brain, so to speak. So all your emotions are tied to your gastrointestinal. This is something I found out through studies. And so if your body is not at ease, or you're distressed, or you're stressed, or you have anxiety or depression or things like that, these are compounding factors, right? So of course, there's disruption. You tend to overeat. You tend to be more agitated. You feel uncomfortable, more swollen. And of course, sometimes it could be painful. So be mindful of that. I mentioned about stool in the blood, so blood in the stool, and indigestion. It could also mean that there may be a disorder in the stomach, and some food passing through this GI tract is sort of not agreeing with you. So it can appear as stains in the stool. Indigestion can cause because of the GI issues, which is the gastrointestinal issues, and early fullness after eating. So you feel full, very full, bloating, discomfort, burning or bloating in the abdomen. So I would discourage taking, an antacid to sort of mask the symptoms, but pay attention to what's happening. Go for something natural. If you can, maybe some ginger, things like that that can help you if you're able to. Fever and loss of appetite. That's an indicator as well. So your body temperature, it changes. It's a strong indicator of an infection, abnormal increase in the body temperature. A loss of appetite is that indicator versus overeating because you feel bloating. And then, excuse me, there are other conditions that you may want to pay attention to. Cramping is another, as I mentioned in the previous slide. But if you suspect this is a condition that you may have, the diverticulitis, again, seek your health practitioner to sort of explain what's happening with you, and they can do the necessary tests to identify or rule out what's happening with you. So this condition is a common gastrointestinal problem. It happens, as I mentioned before. So the area of natural weakness in the wall is where arteries are connected. So we can develop anywhere, as I mentioned, in the GI tract, but it's called the sigmoid colon. So this is where it most frequently happens, the left portion of the colon. That's why you have pain on the left side of your stomach. And this is called sigmoid colon. So dangers of this condition, diverticulitis, just left untreated, can have, real life severe consequences, including death. Abscesses are just one complications, as I mentioned before. If there's a form, they can break through the intestinal wall. This can happen. You can develop periodontitis, an infection that can be fatal because all of these foreign agents are coming from the stomach into the bloodstream, into your cells, into every other part of your body that's considered like a foreign agent. And so the body's working overtime, and the system isn't trying to attack. Everything's trying to bring your body back to normal. But where these things are not supposed to be can cause, irreversible damage. So tears in the intestinal walls can leak waste into your abdominal cavity. We can get poisoning of the blood and of course leading to an infection. So finally, the inflammation associated with this condition can lead to painful bowel obstruction, which is something can happen to in severe cases. So what do we consider as fiction versus nonfiction? Well, a couple things, there's a lot, but I just want to highlight a couple. Most people think that every time they have pain in the stomach, it is that, diverticulitis. So there's a flare-up. Where if you think you've been diagnosed, you sort of get anxious, you're paying attention to, how frequent you're getting flare-ups. Not necessarily the case. So the best thing, of course, is that there's certain type of foods that have been told that from the health field to stay away from. But over studies have shown things like nuts, corn, popcorn, some of them are GMO, some are not, depending on what you're eating. These can actually have, some issues in your system, depending on if you have other underlying conditions. But for these two conditions, diverticulosis and diverticulitis, it's not associated with the increased risk of this condition or even the bleeding. So there's a study that was done that's proven that with over 50,000 people, both men and women, both age 40 to 75, that this is not the case. And so there's no link. But of course, practice some common sense, eat these things in moderation. And sometimes we tend to eat things that we like more frequently than we should. So if you think nuts and seeds have led to an episode, pay attention, keep track of this to see how if it actually is causing more of a flare-up. And then, of course, avoid them in the future. So that's just sort of rule of thumb. So like someone who, for example, who may have, an allergy, and then they find that their body has changed, and so they actually go to try that food item that they're allergic to, and then they have a breakout because they've avoided it for so long, they think they're okay. So pay attention. So there's different types of areas I want to bring to your attention. I'm not going to go into them, but one is called diverticular column, is the sac-like protrusion, diverticulosis, diverticulitis, so inflammation. That's when it changes from one to the next. And of course, you have acute or chronic. And then you have diverticular disease. And so this is significant. It's symptomatic. It's the bleeding colitis associated with this particular condition, which is the stage it goes to, and then the diverticular bleeding, which is painless, bright red blood in the colon due to weak blood vessels. And these are different symptoms, different areas of the intestines that are sort of attacked or impacting you when you have this condition. And at time you may have this condition tied to another illness. Another thing to be mindful of in all illnesses, all diagnosis, there's also the underlying risk of depression, stress, anxiety. So these are things that many people don't speak about unless you're speaking to a profession, a person in that profession. But be mindful, pay attention to how you're feeling. Sometimes you might have moments of feeling hopeless or, feeling that you're out of control with what you're going through. And so think of this as a condition that, that has many different components. So the inflammation we know happens, the infection happens, sometimes you're impacted with all of these things, and of course it impacts your mental health. So the pain, the dietary restrictions, the frequent medical appointments can create a sense of constant worry and stress. And of course, the fear of flare-ups can lead to anxiety, which can develop from mild to moderate stress to extreme. From anxiety to mild to moderate, depending if you have other underlying conditions, could also lead to that as well. So think of it this way, that you're able to manage one, you're able to manage all, especially if you're mindful of everything that you're going through, what you're eating, how you're feeling, how you're sleeping, how you're moving, right? So while the chronic nature of the condition can sometimes contribute to feelings of depression, recognize the connection. And the first step towards effectively managing both your physical and mental health is being self-aware, being mindful. Some tips I want to share with you on managing the anxiety is being mindful and through meditation, if you practice meditation as well. It doesn't have to mean that you sit for a certain time to meditate. You could do something called walking meditation. You can do other things like painting or sketching or doodling, sort of getting your mind off of things. And that can actually be a form of meditation. Also, meditation, and I'm a believer, meditation and prayer is also great. Being mindful, being self-aware, regular exercise is really important to reduce anxiety. Healthy eating, be more mindful planning your meals ahead of time so you can reduce the amount of flare-ups that you have because certain food can trigger this flare-up. And of course, increase anxiety about the condition. Routine structure, create a structure for yourself that you know that takes the guesswork out of it so you don't have to compound with more anxiety as to what am I going to eat? How am I going to eat? How frequent should I eat? Especially when the day comes at you and you sort of have to juggle things around. And, many of us wear many different hats. So of course, be mindful of that. Creating a systematic way of dealing with this condition, you're telling yourself, telling your brain, telling yourself in the sense of your higher version of you that you matter, self-care matters, and of course you're paying more attention, more diligent, and of course it may seem like a task, but if you plan your week on a Sunday or Saturday as what you're going to eat, giving yourself a little bit of flexibility here and there, then you find you become more habitual in the way of healthier eating. There's something called therapeutic techniques, a CBT, I've mentioned before in other presentations. And so there's something called cognitive behavioral therapy. You can seek your in your area as to who actually will be able to help you with a therapist, if that's the route you want to do, if that's something that's in your line of your health journey. It's a particularly effective way for managing anxiety. So it identifies and changes your negative thoughts through pattern that can contribute to anxiety. So you sort of creating like a coping mechanism as to how to deal with these things. Because once you're full on into anxiety and stress, it's sort of hard to pull yourself out if you don't have these things in place to mentally trick yourself out of these things, or these emotions and the feelings that you're having. The managing the depression part is to stay connected. Have to reach out to a friend that you know, like, and trust, or a family member to sort of take you out of that mindset and to have to shift your brain into being into part of that social connection to be able to get that support you need. Because all of us, although there's a saying that no man is an island, right? So we need to be able to work together in the way of supporting one another through our health journey. But of course, you go to someone that you know, like, and trust, that can be able to give you that support, vice versa. So engage in activities you enjoy, to lift your spirits. Journaling, I like journaling. I haven't done it for a little while, but I love journaling. Get my thoughts to paper. It sort of releases the emotions that I'm feeling in the way that out away from, focusing on the problem into a state of being grateful. So there's certain ways you can do it. It doesn't have to be a lengthy writing. It can maybe one page, half a page, a few lines, just to get your mind off of that. And one of the trick that I learned from a very good friend back in the day is that once you get up in the morning, before you do anything, you take a pen to paper. You don't lift the pen off the paper until your head is clear. So you sort of write all the things you're feeling, even if you're doing a prayer of gratitude or journaling gratitude, something to get your mind to shift out of that thought, and you find that you're consciously being mindful of what you're putting on paper, and the flow of it will help you to shift that energy. It can help you to process the emotions and gain insight because you get more clarity. More clarity. Self-care practice, making sure that it's a crucial, you identify self-care time in the pockets of time of your day to go to shift from focusing on others to focusing on yourself with them. So one of the things, getting enough sleep, that's something I've been practicing for a little while. I'm getting better at it. Some people, it's hard to shift to get the proper 8 hour or 10 hour sleep if your body allows it. Most people are functioning on 3 to 5 hours of sleep, which is not long-term, not good for your long-term health. So eating well, staying hydrated, taking time for yourself. But of course, if you find that all of these aren't working for you as effectively the way that because your body will tell you, your energy will tell you how you're feeling, seek professional help. You know, there are symptoms of depression that may not be able to handle on your own. So seek a mental health professional. There's a stigma around mental health, but of course, you go to the right source, those who will provide support, and knowing that you can speak to someone without being judged and criticized. Because depression can manifest in many ways. Persistent sadness, loss of interest. There's something called smiling depression. You're smiling and laughing at everyone else, but you're actually depressed, right? So you don't want to feel like a burden, so you don't express how you're feeling. And of course, changing appetite and sleep, those are things that can happen, even feelings of hopelessness. So there's something I want to bring to your attention. I know we spoke about this condition with the GI tract, the gastrointestinal tract, which is diverticulitis. The gut is something that is sort of underrated in the way how when people speak about it as that are connected to other illnesses. I mentioned before leaky gut syndrome. So what is gut health? Gut health is something you need to pay attention to, because most of us, we look on the outside, we feel okay, we look okay, but we don't feel okay. So your gut is more than your stomach. As I mentioned before, it includes the entire GI tract, which is a gastrointestinal tract, and the esophagus, stomach, and so forth. But these are all key components. So the signs of an unhealthy gut is basically asking yourself is, how do you know if your microbiome is healthy or not? This is a simple check you can do, paying attention to your body. If you have regular experience with these digestive symptoms, your gut microbiome may be out of whack or out of balance, right? So bloating, excessive gas, constipation, diarrhea, heartburn, abdominal pain. These are similar to that illness, but you may not necessarily have the diverticulitis. You may just have unbalanced gut. So again, you got to pay attention to that. So these are the signs of an unhealthy gut. The microbiome is something to pay attention to. Of course, this is where it leads to unhealthy. So how do you improve your gut health? Well, your daily habits, especially what you eat, how active you are, play a major role in keeping your gut balanced. So everything from what you eat, drink, and how you move, this all shapes your gut microbiome. So the best foods for the gut health we want to think of is, for example, prebiotics. We know we talk about probiotics, but prebiotics is something else well that help with your digestive system. Foods rich in soluble fiber, veggies, fruits, whole grains. Now, if you're not a veggie person or a fruit person, there's smoothies you can have, right? That's the best things you can have, like a booster shot of those type of vegetables and fruits. And these can help to feed beneficial bacteria in the gut. And of course, probiotics. We know fermented foods, yogurt, kefir, sauerkraut, miso. Introducing these beneficial bacteria into the gut helps to balance the gut, to improve your gut health. So certain foods may help prevent complications of these two conditions, diverticulosis and diverticulitis. So these two are the problems that affect the colon. So start small for your better gut health. Taking good care of your gut doesn't require pricey supplements or extreme diets. Start with simple, consistent habits, right? So eating plenty of fiber-rich foods, incorporating fermented foods in your diet, limiting processed foods and alcohol. When I was younger, till I knew better, I was every week, 2 or 3 times. Sometimes I'd go someplace that have junk food, which is not great. As I've learned and grown and educated myself, I still do the junk food, maybe once a month, every 2 months, because these are habits that you're trying to, sort of wean yourself off of. Again, we're being proactive, but in between your daily habits of eating and changing, just one small step at a time, until you feel that you have a routine, a consistency of what you're doing. A little walk, a little stretch, chair yoga, all these things will sort of compound into the better version of you, right? And I found some information through hopkinsmedicine.org that can actually give you a full detailed article of other tips as well. So eating high fiber diet can prevent constipation and reduce the risk of developing this condition, which is called diverticulitis. The optimal diet for this relief is recommended. So promote a regular bowel movement, prevent the buildup of waste material, incorporating ample amounts of these fruits, vegetables, whole grains, legumes can help soften your stool, ease bowel movement. Staying well hydrated is very important, and that's something for me as well. Examples, one of my um, goals is to drink more water. And some people they can drink, 8 to 15 glasses of water, and I'm getting to 8 glasses, right? So for me, it's making a daily reminder for myself. This app that can remind you to drink water. You can hear the water sound. But of course, it's to stay hydrated. That's the most important thing. So things that are going to help you to be able to stay hydrated. Some foods, for example, cucumbers and all of these things are water-based. That's also adding to your water, staying hydrated. Food rich in probiotics I mentioned before can help promote gut health and aid in digestion. That's very important. So the worst food for gut health, as I mentioned, is ultra-processed foods. This make up about 60% of the average of North American diet, which is very high. And that's a problem for our gut health. So some high fiber foods to stay away from during this time is when you, especially if you're having a flare up, it's important to let your digestive system relax and to heal. So avoiding certain foods when high in fiber, when you're not having a flare up, you need to have these things. But when you're having an actual flare up of this of diverticulitis, is to limit or eliminate for a short period of time the things you would need to stay away from: fresh fruits, apple, pears, raspberries, vegetables other than canned, green peas and broccoli, oat bran, whole wheat. These are all bulky. Brown rice, even popcorn. I know we talked about before the popcorn is not something that will trigger it, but just to reduce it or eliminate it once you're having your flare up, and pistachios. So this word of diverticulitis is scary, but it's manageable as long as you're paying attention and being proactive, so that you can reduce the anxiety and stress and depression that may compound what you're feeling and going through. Is to be mindful and to have, I mentioned this arsenal of coping skills, coping mechanism, being aware. So things like yogurt. Now, be mindful as well. Many yogurts on the shelf for long shelf life are loaded with sugar, added sugar. So avoid these options. Choose plain yogurt, no added sugar, or just limited amounts. If you want to add honey to it, that's something you can do. But add natural sweetness by topping it with your favorite fruit, especially if you're not having a flare up. And of course, alcohol consumption is a great gut health offender. Large amount of consumption of this can sort of disrupt your microbiome. This is also linked to several cancers, including colon cancer. But this may be possible harmful effects impacting this microbiome of your gut. So according to research for the University of Oxford, fiber reduces the risk of this condition, the diverticular disease. So the studies focus on fiber from fruits, vegetables, cereals, and potatoes. So tips for higher fiber eating is go slow at first. Expect some changes, for example, being more gassy or bloating is normal. Staying hydrated, and of course, consider supplements. So there's some supplements that I found through some of the sites I mentioned before, the credible sites, and also some superfoods I'm going to share with you in a little bit. So how you can improve that, integrate into your daily regime. If you are be mindful as well that there's some people that can't have certain things. So of course you can take a certain medication. If there's other type of supplements that you've been told that you can consume, check with your pharmacist. They study natural medicine. But these actually are relatively safe. Aloe, cyprium. Um, Also be mindful if you're buying aloe berry juice, make sure it doesn't have aloe latex because it can cause severe stomach cramping and diarrhea. Licorice root, digestive enzymes can break down the food, probiotics I mentioned before, vitamin C. So be mindful as well to not take too much vitamin C. So going back one, these are some of the things I mentioned before. So treat this particular condition, but also be mindful that you can take too much of a good thing, especially when your balance is your gut microbiome is out of balance. So if you take vitamin C, be mindful that you take too much. It can cause diarrhea or stomach cramp. So the acidic supplements might also irritate your inflamed colon, especially if you're having a flare-up. Vitamin B3, be careful that you can lead to gastrointestinal upset, like nausea, abdominal pain. Iron supplements, if you're taking iron, it's known to be harsh on the stomach, can lead to constipation, bloating, and abdominal pains. If you have diverticulitis and you actually take an iron supplement, be mindful this could be a trigger. Multivitamins with stimulants. So, for example, if you take a multivitamin that contains herbal additives like ginseng, or caffeine-like compounds, which can stimulate the digestive system. These can actually cause discomfort. Fat solubles like vitamin A, D, E, F in excess. I guess in moderation. Everything's in moderation. This can actually lead to toxicity and digestive issues. Magnesium in laxative form is essential for your body function, but certain forms like magnesium citrate or oxide often they consider as laxative, so it can cause diarrhea and increase pressure on the colon. Fiber supplements during flare-ups, like some people's okay, I'm constipated, I'm gonna have some fiber supplements. It's actually not good for that type of condition. So things like psyllium husk, these are things that make things worse because it increases the bulk in the colon, which can put more pressure and cause more inflammation. Calcium carbonate it's important for bone health, but it can cause constipation. So these can trigger some of the conditions you're experiencing through the if you have been diagnosed with diverticulitis. So also drugs to avoid if you have this condition is NSAIDs, which is anti-inflammatory drugs, increase the risk of this condition and this complication. If you take it for more than 2 times a week, ongoing, this can trigger that. Corticosteroids increases developing diverticulitis. Some studies report that people taking this particular steroid are twice as likely to develop a hole in the intestinal wall. Opioids, past and current use of this increase the risk of this condition, including bleeding, perforation, bowel obstruction, and so forth, even sepsis. Calcium channel blockers, so people who take these drugs have a higher risk of perforation, bleeding with diverticulitis. Anticoagulants, these are blood thinners, prevent blood clots from forming and stop existing clots from enlarging. However, they can increase the risk of diverticular bleeding. So drugs that can cause the constipation, this can cause, these are a list of things. So this condition can cause constipation, but the reverse is also true. Constipation raises the pressure in the colon, which can cause protruding sacs. So many over-the-counter prescription drugs, like opioid, blood pressure medication, can cause constipation. Even antacids containing aluminum and calcium. Things like antipsychotic drugs, diuretics, these can cause dehydration. This can worsen your condition if you have diverticulitis. So these are things to be mindful of. If you're a cancer survivor, hopefully that you've ended your treatment, or you've been a long-term use of this menopausal hormone therapy. Some people's 5 years, some people's 7 or 10 years. It actually, the therapy that you're taking to be able to help you to not get a recurrence of cancer cells, of cancer, sorry. This actually has a higher risk of diverticulitis. So there's a study shown that this is actually an actual side effect if you have taken or done menopausal hormone therapy. Some of the tips I want to share with you, if you have a flare-up, is to start a liquid diet. Another is to add low fiber foods, slowly follow high fiber diet once you have recovered. Or over-the-counter medication can be helpful, but again, be mindful, pay attention to the side effects of those and talk to your health practitioner. Consider using probiotics and vitamin D, not in excess, to help with the gut health. Heating pads may help with pain, and of course, avoid alcohol. This liquid diet I speak of, what can you do? What can you do to be able to shorten the time? Well, the flare-ups happen. You want to be able to reduce the amount of time that you flare up. So your doctor may say, okay, stop eating, may tell you to stop eating, drinking altogether for a short time. Well, you need to be able to rest and recover, but you need to have something to sustain your energy. So the pause in eating is sometimes called a bowel rest, or we call it reset. So after this brief, your doctor may recommend you to avoid solid foods for at least 2 to 3 days. Again, refer to your doctor for further consultation. So if you have a flare-up, you want to go to a liquid diet, things like broth, juice, apple juice, cranberry, grapes. I would say if you do cranberry and you do white cranberry to ensure that you're not passing blood in your stool. Grapes is also a personal choice, but just to make sure that you don't have any further complication, make sure you have clear liquids. So, for example, here's a benefit of the bone broth. If you have, you tend to gravitate to that to give your body that rest. You got the rest. Fruit juice, no pulps, water. Sports drink, it's an iffy for me. It makes sure that it doesn't have a high level of caffeine or even artificial sweeteners, but that's to me that's a personal choice. Tea or coffee, but make sure that these, of course, caffeine is a stimulant. So there's actually something we'll share with you that will help you to be able to consume and enjoy your beverages without the flare-ups that you would normally have if you have this condition. Don't add any dairy, milk, cream, any of that type. Exercise is a great benefit of exercising. So it has shown that exercise can improve digestive function, reduce stress, improve overall physical and mental health. And also this can be added benefit for those who are going through with diverticulitis. The exercise can also help promote weight loss, which can reduce the risk of developing this condition in the first place. But if you have it, at least you have this as part of your coping skills, coping mechanism. The regular exercise helps reduce the flare-ups. It improves digestive function, promoting regular bowel movements, lowering pressure in the colon. So these are some of the great benefits you can have. And I would say I would add to that an overall sense of well-being. But these studies have associated vigorous physical activities with a significant decrease of developing this condition and related complications, because I mentioned before, everything is connected. There's a PubMed study at the bottom part with the PubMed ID that you can have for further information. The type of exercise you would consider: low impact workout, walking, swimming, yoga, even Tai Chi. These are recommended for people who have diverticulitis. The types of exercise can help improve circulation, reduce stress without putting too much strain on the affected area, because as I mentioned before, you may have pain on the lower left. And so extra strenuous exercise can sort of aggravate that. So incorporating physical activities into your daily routine, it improves your overall fitness level, but also boosts your immune system. So which can be a particular benefit for those who have chronic conditions like diverticulitis. Exercise after a flare-up, here are some tips. When you have a flare-up, I would suggest not to go back into strenuous exercising right out of a flare-up. So if you can start gentle, light exercise, avoid strength activities for several weeks, at least 6 weeks or more, pay attention to your body. It is crucial to consult your healthcare practitioner before you exercise, just to make sure that you're on the right track to avoid any additional increase in pain or discomfort. And listen to your body. Avoid these activities if you find that your body is saying no or screaming you to stop, for you to stop. And of course, stay hydrated through this process. So in addition to all of these, there's some superfood that I will introduce to you, or share with you that I've been consuming for the last 14 years. But there's different types of superfoods. They all have benefits. Some are the higher on the hierarchy of superfoods on the top part, some are middle or the lower. I like blueberries. I love, almonds. I love quinoa. All these things are great. I just had some pomegranates myself. But there are many type of superfoods you can consume. But what I'm going to share with you is one called reishi. It's also called Ganoderma lucidum. All the different superfoods on the planet, and there's many, is considered number one because it falls under two categories, medicinal and food. So food supplement, excuse me, and medicinal supplement. Is one of the most alkaline food on the planet because it has so many health benefits. There's over 3,000 case studies through PubMed.gov of just on this one particular superfood, and it's still growing. Why is that? Well, I know we have to have a right amount of supplements to have optimal best performance in our body. Like, we have the right probiotics, prebiotics, things like, your terpenoids, your flavonoids, all these things are part of compound makeup of your food, what you eat, vitamin antioxidants, amino acid, minerals. We don't get them in our regular food because the soil is heavily depleted. So we're not getting sufficient vitamins, nutrients, especially in the change of the season, especially winter time. May be deficient in vitamin D3 and don't even realize that because, we're indoors. So we eat to get the fuel, but when we eat, we need to get the right nutrients. So this reishi, or Ganoderma lucidum, has over 150 antioxidants. So as a comparison, for example, you may have, let's say, strawberries. You have 10 in the way of the international units, in the way of the what you can get out of just strawberries versus 150. So 15 times more power packed antioxidants from just one single dose of Ganoderma. So we know that when you're getting the right type of foods, right type of nutrients, your body responds in the way that it's meant to. The body's meant to heal itself, but if it's not getting the right things, it cannot heal. So the antioxidants, the main thing, for example, it protects against free radical damage up from down to the cellular level. It helps with many things, including your gut microbiome. Terpenoids, so then foods that we know that they help with anti-inflammatory. Flavonoids, we know it helps with reducing inflammation. And it also has many protective compounds, including a neuroprotective sort of component. So Ganoderma lucidum has three different stages, which is the roots. We call the baby Ganoderma. It's called mycelium. Then the fruiting body, which you're seeing here to the left, is called Ganoderma lucidum or reishi. So it's packed with, polysaccharides, flavonoids, and these antioxidants and anti-inflammatory inflammation properties are so nutrient rich that your body actually responds because it's considered an adaptogen. So it goes into your system and it performs the way it's meant to, depending on what you're feeling, experiencing, you'll be able to tell best because the body doesn't lie. So not only is it helping with that, we talked about depression before. Anxiety is actually known to help with these things, to be able to eliminate or to reduce or the symptoms of it uh, as you're getting the right nutrients for your body. So the third part of the reishi is called spores. Ganoderma is spores. They're little seeds. And these seeds go into the ear, onto back onto the plum logs, and they generate more. So there's different types on the planet, different types of mushrooms, but this particular one, reishi, has all of these components. So the reishi, I tend to gravitate to the word reishi, which is Japanese name for Candida lucidum. Candida lucidum is the Western name for the same mushroom. So it promotes recovery of the intestinal barrier protection. I talked about the intestine. It also reduces the mortality and body weight. So it helps protect its protective effect against certain things like colitis. I mentioned before there's colitis and there's diverticulitis, tongue twisters here. But it promotes the recovery of this in the gut microbiota dependent manner. So again, it's going to the gut and healing the gut. The spores, I mentioned before that there are three different stages. The spores has 17 times more power-packed nutrients, which inhibits inflammation and, of course, protects the colon and, again, the gut microbiota, bring it back into balance. So it also helps with suppression of obesity and inflammation. It's a prebiotic agent. I mentioned before, prebiotic and probiotic agent in inhibiting obesity, but also many other compounds, including inflammation and gut barrier function or protection, and gut microbiota as well, helping all of these. We know it defeats stress, and these are all findings through PubMed.gov. I usually put the source on each page, but for some reason missing here. But PubMed.gov, you put in the PubMed ID, you search, and has a lot of information, more than what I'm giving you here. It also has the spores itself acts as an antioxidant regulator. So weight loss, colonic shortening, diarrhea, bloody stools were observed to be eliminated or alleviated after you've taken the Candida lucidum spores. We do have we have a great friend, his name is Dr. Bob Bukowski. He there's the therapeutic dose, which is the capsule form, and there's other doses you can take. Most people who have an underlying condition, you sort of ramp up on the Candida lucidum spores so you can see how the body is performing, because there's no toxicity attached to this particular mushroom or superfood, we call it. But it's considered a food supplement, so you can't overdose on food. This is the great thing about this particular mushroom. So not only is improving your depressive-like behavior, it acts as an depressant, it helps with individuals who have mild to moderate to major depressive disorder, if you have this underlying condition, or if you are experiencing anxiety and pain and depression, if you have this condition of diverticulitis. So we talked about the mycelium itself, which acts as an antidepressant. So that's the baby Candida, the roots. But we know they all have great benefits and they all support the immune system. So the important thing also I want to share with you is that not only is the Candida a food supplement and a food mushroom, sorry, uh, medicinal mushroom as well as a food supplement. When you consume things like these in different forms, you're finding you're getting the benefit because you're getting the right amount of polysaccharides, antioxidants, all of these things that you need. But if you're consuming, for example, a cup of broccoli or a cup of green tea, you may not get the sufficient amount of supplements you need for the day. So Ganoderma acts as a dietary supplement factor. So things like flavonoids, these are things you get in your everyday food consumption. For example, green tea, you get vitamin C, E, D. But if you're taking any type of supplements or medication and you're consuming these type of mushroom, it actually helps your body absorb these medication better, more effectively, more efficiently, as well as you're taking other supplements. It actually helps to absorb, especially if you are, for example, you're overcoming a cancer scare, you had a cancer treatment. We're not speaking about cancer, but I'm giving it as a point of reference. So the gut microbiome as the crucial factor that can affect the different type of things, but it also acts as a autoimmune protector. So it actually helps to balance your autoimmune because we have overactive or underactive. But the one thing I want to share with you is that if you think of your body in itself of having multiple organs, cells, blood, all everything connected, including your gut intestine. There is actually a study done that shows that if you have, for example, multiple organ dysfunction, which is part of your body, you're finding that your body's inflaming in one area impacts another area. So the actions as improving the getting the right amount of polysaccharides, it actually helps alleviate the inflammatory response. So when we speak on the three levels I mentioned before, I'm sharing with you is actually the mushroom. They come in different stages. The fact that you have access to these things is something that we didn't know about 14 years ago, but there's over 3,000, years of this particular the history of this particular mushroom and over 3,000 plus studies on PubMed. Now, this is not from myself, actually from credible sources. I'm credible, of course, but want to share with you those in that profession of the health profession. They've done their due diligence and they've studied. So for us, we consider health enthusiasts. I want to share this with you as what I think would be an option that you can consider. So if you're speaking on different type of benefits, the fact that we have everything connected from your gut to your intestines to your mental health, all of these things is a balancing act. So if we know that the last PubMed I'm sharing with you at the bottom here, we know that the reishi is known to impact the colon health. It also provides the valuable nutrients it needs, but also because of the high amount of polysaccharides, it actually helps with many other conditions. If you're looking at another type of mushroom, it's called cordyceps. And cordyceps helps with your many other things, but it can work on its own or work synergistically with the reishi. And so the last PubMed study I want to share with you on this slide, PubMed ID, it actually helps to modulate intestinal barrier function and the gut microbiota. So it helps with your strategy for improving your intestinal health. The one above that also helps with it acts as a prebiotic to reduce the side effects of any treatment. So if you're going to a particular treatment right now or taking medication for diverticulitis, you're consuming the cordyceps as well as the reishi or on its own, it actually helps to treat intestinal immunity. So basically, it's improving your intestinal tract as well as your gut, improving your gut health. And it also anti-inflammatory, has the antidepressant-like effects as well. The cordyceps itself helps with depressive behavior, alleviating that, and also unpredictable chronic mild stress. So again, the body's stress, and you're dealing with many things. The cortisol also helps to improve sleep because that's something that can be impactful if you're depressed. So you're losing sleep, your thoughts are racing, you're feeling all these emotions. It helps to relieve these anxiety moments or stressful moments that can lead to depression or further escalate. So if you're looking at cordyceps as another option as well, there's something you can have in the way of different infusion into different type of products. But again, if you're looking at another one, it's called lion's mane. So lion's mane, a year or so. Just want to make sure. I apologize. Nice. Yeah, I apologize for that. I think if you can hear me, let me know. For some reason.
I hear you. I just don't see you.
Yeah, something's up with my mic, but my sound, but it's okay. The most important thing is the slide, so it's okay if you don't see me. But thank you for that feedback. I appreciate it. So the lion's mane is another great mushroom. It helps with the cognitive cognition, depressive disorders, stress, and moodiness. We talked about, the depression and mental health, including depression and anxiety. It impacts you. So it not only is it helping with those type of conditions, it also helps with restoring the gut-brain axis. So it helps with the mood, also help with balancing your gut because your brain needs a signal to your intestine, needs a signal to your gut, needs a signal to your organs and every part of your body, and it is disruption. You need to make it get back into the right balance. So consuming lion's mane, I found in my personal journey has helped with my cognition, my focus, my mood, and your perceived perception on your feelings as well as your sleep. So you're giving your body what it needs in a way for the gut, the intestines, but also for your brain. So then we know that the impact of the microbiome on the brain can lead to like the inflammation and gut barrier function we mentioned before. This is part of your intestinal tract, which can trigger, an inflammation because you've had sort of flare-ups through diverticulitis. Think of this way, it's ongoing, but you're consuming things to help to reduce the inflammation. To get your body back into balance, you have less flare-ups. And the body doesn't lie, it tells you exactly how it feels. So not only is that it's helping to improve your body in the way of the weight, it also decreases the intestinal bleeding if you were to consume lion's mane. Helps with reducing the inflammation because it's anti-inflammatory. It acts as a protective agent, shown to be effective, especially for those who have, like, for example, IBD, in this case, diverticulitis, because they're all, being impacted through the GI tract. Lion's mane also, combination with different types of vitamin B3, 8, these can also help with inflammatory burdens, especially if you have a bowel disease. Polysaccharides from lion's mane is a natural alternative and in conjunction with traditional remedies is anti-ulcerative colitis ability and the best anti-inflammatory activities. And I mentioned this because we know that some individuals may have both, may have ulcerative colitis and diverticulitis. Or they may have diverticulitis, but some of the symptoms, of course, the flare-ups are similar to this condition. So the lion's mane would be a great source of nutrients to get, or three working together. Now, if you are a person who consumes coffee and teas regular, this might be a best solution for you, win-win. We actually have a brand called Organic, which we represent, and through the power of this kind of demo, we are loving the ability to be versatile in what we share. So we're a brand with a purpose. We help people create better lives through healthier and richer lives. And we know that with Canada, this could be the potential passport for a holistic wellness approach. And so we know through Health Canada, we have our natural product numbers. We have over 32 certifications on the way of, for the process. So we have the ability to state that, through the 32 certification, the quality of the product, as well as knowing that it helps support the immune system, it can fight infections and diseases. So it has many health benefits, but of course, as you're consuming it, your body will tell you exactly how it feels. It doesn't lie. So think of it this way, one small choice can have a lasting impact by making that switch. And so we represent, my husband and I, and many of our business partners. We actually want to move in a way of mindfulness, positivity through wellness. And so we're a world leading brand. And so I mentioned before Rishi, Cordyceps, as well as Lion's Mane. Think of it this way. We all know that we have to take, either something through our stage of life, something to help improve our life. But we don't always move to the right, uh, take medication because there's a mindset there. But what if you were to have it in your everyday consumable items like coffee, teas, and hot cocoa, where the properties of these particular products that you know, like, and trust, and the brands that are on the market, they may have negative effects because you're consuming them, which cause a flare up. But you have a brand that actually, with, for example, the coffee is infused into the coffees, teas, and hot cocoa. So it changes the negative effects of the properties of the coffee, teas, hot cocoa, that you don't have any of these flare ups. So you're switching your brand, at least for 30 days, 60 days, 90 days, just to see, because the body's been, sort of triggering these flare-ups from maybe a long time, but you may need time for your body to respond. So it comes in forms of the teas, coffees, hot cocoa, but also in the capsules to the lower left, even in toothpaste. We do have a skincare line which doesn't have that, but I just want to bring that to your attention. But the three can work synergistically together or on its own. And I love the fact that we are certified organic, 100% certified organic, as nature intended, not going in plastic bags like other brands. Other brands is still considered certified organic, but they don't have as much nutrients because they are grown and they're missing components as nature intended. But most important to pay attention to is that the to your far right, the artificially grown certified organic Ganoderma cannot produce spores, whereas naturally grown can grow all three stages. And so the absorption rate actually is 99% when it's naturally grown through all the patent process we have versus something grown into your plastic bags, which has between 4 to 40% absorption rate weight stays in your body. This is what I'm sharing with you before, which are the three stages of the Ganoderma, the baby Ganoderma, which is the mycelium, the fruiting body, which is the actual, as you see to your left, the capsule, and then the spores, which are the seeds, which are more potent because it has more nutrients in there. But think of it this way: you're consuming something every day. You're able to be are able to consume something every day without overthinking it, like a cup of coffee or tea or hot cocoa, and you're getting the nutrients you need. So this is one is this is a Royale, which has three. All three mushroom blend in the infused into the coffee. You taste coffee, you don't taste mushrooms, but you get the benefits, which is a bonus. So as I'm sharing with you and I wrap up, also I want to bring to your attention, there's a tea we have which is called red tea. It's caffeine free naturally, has a lot of good components, the benefits just from the tea alone, but it's infused with cordyceps as well as the Ganoderma. So if you're not a coffee person and a tea person, you can best of both worlds. If you have like both like myself, you can actually change the plan. So right now we have a promotion running until the 4th, which is in 2 days, and we have the bundle package. For example, if you tend to gravitate to the capsules, you want a more therapeutic dosage of it, there's a promotion, get 20% off of the retail. If you want to try the coffees, you can do that. Christmas is coming up. You can give us a gift to yourself as well, gift of health. And so we are in 36 countries. So if you wish to give a gift to someone in another country, you can do that from the comforts of your home. Reach out to the person that has invited you. For those of you who live in North America, there's free shipping right now, limited time offer May and wrapping up in the next couple of weeks. Anything over $50 US, it's free, in addition to the 20% off of the products. So as I share this with you, I thank you so much for your time. I hope you got some value from that. I'm going to take myself off of looks like my camera's not working. Any question that you may have? And I'm going to read the comments whilst I'm asking this question. Yes, I see that you mentioned that someone had oh, okay, so someone had diverticulitis and they couldn't eat seeds. Yeah, this is something, especially when you have the flare-ups. All right, any questions you may have or before we wrap up? All right, so thank you so much for your time. We started a little bit later. I'm actually going to stop the recording. Let's see, 1 second. Awesome.